Good afternoon and welcome to HealthSystemCIO.com's All-Stars panel, revamping your existing data governance ecosystem for improved analytics. A webinar tweet chat combo from HealthSystemCIO.com sponsored by Collibra. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the editor-in-chief of HealthSystemCIO.com. I will be your moderator today. We are having a simultaneous tweet chat hosted by Nancy Wilcox, our Director of Sales and Marketing. And you can participate in a separate browser or on your phone by using the hashtag HSCIOchat, or you can simply view the tweet chat in the Media Viewer panel on the right-hand side of your screen. Other WebEx panels we'll be using today will be the Q&A panel, which you can use to submit questions as they occur to you. Just leave the default set to all panelists. We will be posing those later in the program, but again, send them in as they occur to you. We're also going to launch a poll today, and that will open in the polling panel on the right-hand side of your screen. And you can see the URL to download the deck. It's at the bottom of our slides and also being sent out in the chat box. Just so you see how we're going to spend our time today, we're going to go about 35 minutes with our featured panel discussion. And for our panel, we've got Kim Jackson, VP of Strategy, Products, and Governance with Providence St. Joseph Health, Lori Moore, Director of Data Governance with Sharp Healthcare, and Chris Cooper, Healthcare Strategy Leader with Collibra. So without further delay, we're going to jump right into our discussion. Let's start with you, Kim. Can you give us an overview of your organization and role?
Absolutely. Good morning. My name is Kim Jackson, and as you heard, I'm the VP of Strategy, Products, and Governance at Providence St. Joseph Health. We have 50 hospitals and ancillary programs, as well as physician groups across the West, including Alaska, Montana, Washington, Oregon, California, and West Texas. My role consists of the strategy of analytics across the enterprise, as well as emerging products, understanding what our strategy is with our integration from our analytics programs, our data governance programs, as well as our design of our data models. And I'm in charge of data governance, which includes master data management, data quality improvement, a data literacy program, our KPIs, and all things data.
Wow, that sounds like a full-time job. All right. Lori, you want to give us a little information about your organization and role?
Sure. Good morning, everyone. Hard to follow Kim. She's awesome. But my name is Lori Moore. I'm the Director of Data Governance at Sharp Healthcare. We have our own healthcare plan as well. It is offered on Covered California, and it's the highest member-rated health plan in California for 3 years running. We have 4 acute care hospitals, 3 specialty hospitals, 3 affiliated medical groups, and over 18,000 employees, making us the largest employer in San Diego. The Data Governance Program Office is located within the IT structure, and I have purview over all of those different groups, as well as our enterprise and our infrastructure. Our framework is based on the tenets of master data management, metadata management, data quality processes, and based on a foundation with policy and procedure. Right now, we are working on our MDM program that includes provider location, org, and patients, and we work with the Informatica stack. And that's the short of it.
Very good, very good. Chris, 2 tough acts to follow.
Absolutely. But great to join everyone today. Chris Cooper. I lead Collibra's healthcare strategy, which really means I get the opportunity to work with both Collibra's existing healthcare customers, which includes some of the largest health systems in the U.S., as well as our prospective customers and those organizations that are really starting to mature and advance their governance programs. Collibra, as a software platform vendor, really provides an enterprise platform with a breadth of capabilities for helping really engage business stewards, information users across the organization, or as we refer to them, data citizens, those folks who need to use the data that we all help manage and govern. So we really provide that collaboration capability to the organization to start to automate and scale out governance activities, and really provide an enabling capability that makes governance a tier 1 system along with your existing analytics and data management programs.
Very good. Thank you, Chris. All right, Lori, let's start with you on this question. Please provide some highlights of your data governance approach, philosophy, and framework.
Sure. So like I said, our framework has the tenets of MDM, metadata, and data quality processes. But I think that we approach them and we have a philosophy around them that's maybe a little bit different. We go about it through the enterprise, but also we've been partnering with some unusual groups across the enterprise to implement some of those things, like internal audit and legal groups, as well as people throughout the IT infrastructure where we're based out of, instead of always going after the business that, you know, sometimes they need our leadership to show them how to do some data quality and data governance processes, but they need that support and that drive from us. So our philosophy is that there is no standard way to standardize your data, and therefore you have to go about it a creative way. You also have to take a look at the culture of what's going on in your company and make that culture work for you. So my philosophy is use the culture to your advantage instead of always saying, well, I need to change the culture and bend it to the will of data governance. Instead, go in, find the culture that works for you, and make that your data governance vehicle.
Very interesting. Lori, let me ask you a follow-up on that. You talked about sometimes business needs our leadership. One of the issues we've heard when we discuss data governance is that IT gets frustrated with the end users because they don't want to seem to put in the work that needs to be done to get the definitions right. That's got to come from the end users to get that agreement on those definitions to get data governance going. But you seem to be taking a tack of IT needs to maybe do more and ask less of the users. Maybe you can just explain that a little more.
Sure, no problem. Yeah, and I agree. We heard 1,000 times, well, we want better data, but I don't want to have to change my little world, right? I don't want to have to work harder or do anything different. I like my little world the way it is. I just want better data. Can't you do that for me? So what we've done, and to be honest, it's been a struggle to find this balance. We're finding ourselves with what we're calling technical data stewards on the IT side. People who know our source systems really well, know all the history around them, and then also have contact with all of the people out on the business side who are, you know, true SMEs, subject matter experts, but also aren't really ready to take on leadership roles around data. So someone on our technical side is charged with being kind of a leader of that domain and knows all the technical ins and outs of the tables and the models and the structures, and then they reach out to the business and kind of encourage them on. And it takes that burden of the push from the business who maybe just doesn't have, they're not ready or they don't have the bandwidth, but they have the knowledge that we need, and it supports them participating in making the data better when it comes from the technical side. So we have to kind of have that symbiotic relationship. So instead of all of our data stewards that are, you know, traditionally a data steward is on the business side, we've kind of built some of that on the IT side. And it seems to be working for us right now. And we'll kind of see and continue to right-size that relationship as we move through and build out more of our MDM domains, as well as some of our data quality processes.
And Lori, when we talk about the business side, we are talking about clinicians as well, correct, right?
Yes, we're definitely talking about the clinicians. So we're talking about things like med staff offices, as well as, you know, traditional stuff like finance, billing. We're talking about HR. You know, we're talking anywhere across the enterprise. They often look to IT for some of that leadership and that guidance. And so we've decided to provide that to them from our side to kind of make their jobs a little bit smoother to participate.
Kim, let me jump over to you, but follow on this line a little bit. When we talk about data governance in IT, getting the buy-in and cooperation and some sort of work out of the business side, don't we have to further separate the business side into HR, finance, all that, and those people can be embraced in one way, and even nurses, I mean, we got employees versus clinicians that may not be employed or may be employed, but you know, some of these high-powered physicians and surgeons, they're a breed unto themselves. So do we need to take all that into account when forming our plans?
Absolutely. So we have a very focused approach depending on our domain, because we found data governance is absolutely important work that needs to happen, but it is a lot of times housekeeping, and not everyone's going to want to clean up areas that don't really affect them. So when we have our governance and our leadership programs, we do it very subject-based, so that the folks that really can implement change are there at the table. If you have too large of a committee and you're talking about a very specific subject, then you lose a lot of interest. So we found that smaller groups help with that. And depending on the audience and the subject matter, then you're going to have different interest levels and capability to motivate change. A perfect example is with the provider master. So that includes people from the med-staff office who have technical knowledge and own their application to providers, and understanding how their role and their work processes affect the work that they do. When we talk about physician attribution, we have a lot of interest in our providers. When we talk about ensuring that the MPI is updated, not so much on the physician side. So we work with and understand the responsibilities of each folks, who their accountabilities are in the data model, and we talk about physicians with that group. When we talk about our patient domain, we have a very different engaged group, from our registration to our rev cycle group and all of those folks. So we have two different committees. We have an overarching one that works together, but when we get in the weeds, we really align to the folks that are really implemented in the work that we do. I've also found that it's important that we, just like we were hearing from Lori about facilitation. So I have co-ownership. I do have a data owner in the business, and I think that's essential for them to push accountability, but they need facilitation help because they have their day job. So I say that we enable them. We have the full people, process, technology stack, and I want to make sure that we just don't write definitions, but we embed them in our technology. So we help with ensuring that all of our data, the technical part, goes not only to master it, but in all the reports and utilization that folks use in their daily activity. We help with policies and procedures, and if they need help also with accountability structures from reviews, we can help write that language as well. So we have some policy writers on our team to help facilitate and move ideas that the business have forward so that they can implement them and have them operational.
Very good. Chris, I'll let you weigh in. You want to talk about, either address what Kim or Lori has said, or if you want to talk about Collibra's approach, philosophy, that type of thing.
Yeah, and I think that certainly we support that notion that you really have to focus your activities, focus the conversation, provide the information that's available, really relevant to the user. And so, Collibra really embraces that concept and construct of domains of information, communities of interest, so that you can really facilitate the collaboration activities that are occurring, the workflow, the process if you're really trying to drive through the organization, the access to information relevant for the appropriate stakeholders and the appropriate audience, independent of what systems that provider information may be implemented in, being able to really abstract how you organize your information assets for the organization, independent of physical deployment of your facilities, types of systems in which that data resides, allows you to bring together the expertise that's really independent of the underlying technologies and, in some ways, our legacy organizational structures that and physical deployment of our facilities and individuals. So being able to bring together people around concepts is something that we certainly support throughout the Collibra platform, and we really see as a key best practice and something that's used extensively throughout the organization. And that really helps protect and insulate your organization through a lot of the changes. We see time and time organizations that go through a facility-based realignment to align more towards service line across multiple facilities. Being able to have information assets that are independent of that underlying organizational structure allows you to very rapidly advance and mature your governance program without really being dependent upon all of the organizational changes, which often have an unpredictable timeline for change.
Very good. Thank you, Chris. All right, Kim, let's go to you here. Talk about the concept of improving an existing data governance process. What are the review mechanisms, such as meetings, boards, and committees, that allow for continuous improvement?
I think that earlier when we were talking about co-ownership and facilitation, that part is super important as we move towards just not having meetings, but encountering and ensuring that we have goals associated with that and have interaction and a cross-dialogue in those meetings. So we ensure that there's actually an ask in each one of our scenarios. In our meetings, we also ensure that we have a goal so that we understand where we want to go so that we can track how much improvement that we've made with these areas and attach it to ROI. It's important to me that we really understand the impact of what we're doing, and if we can quantify that and track the outcomes and associated of avoided cost or improved processes, then that is essential to what we're doing.
Very good. Chris? Chris, you there, buddy?
Sorry about that. Of course, one of the things we really see is that there's a strong need to measure and continually provide that feedback if we're going to be able to make improvements in the process. Far too often, lots and lots of work is being done, good work is occurring at the committee, at the work group level, but the reality is that you can't improve what you don't measure, as the old axiom goes. And so being able to make sure that whether it is at a domain level, at a work group level, there's strong visibility into how the organization is improving the quality of the information available, improving how you are maturing and improving your initial definitions through your fully approved definitions. Being able to provide that transparency back to the organization, certainly we believe is a key driver to making sure that you're able to advance the process. And then certainly making sure that you have the right ownership assigned. One of the things that's really inherent within the Collibra platform is a strong concept of roles and responsibilities for each type of data asset and for each asset within a given domain, so that you can have the appropriate owners and the flexibility to define whether that's an owner, a steward, a custodian, a technical manager, whatever those roles are in your governance program, being able to make sure that those right people are assigned and have visibility to the activities. They can be notified as needed, or they have the ability to go look for information if that's their preferred consumption method. So making that information available at the right level, being able to roll up how is the data quality across all of our patient-related clinical data. Being able to roll that up to the appropriate level really allows you to engage the executive support that's needed to make sure you're supporting the communities and process on an ongoing basis.
Very good. Lori, you want to jump in?
Sure. So one of the big tenets we have here at Sharp is don't let good be the enemy of better. So we take that to heart. So even when we know we have something good going on for us in our structure or process, we keep asking ourselves, what can we do to make it better? And when you take a look at some of our review mechanisms, we realized that our Data Governance Steering Committee was meeting once a month, which was great that we had that much buy-in from leadership, but we found that we weren't bringing enough big decisions to them on a monthly basis that warranted their time. So we decided, all right, so let's improve the process. So we changed the Data Governance Steering Committee to meet only once a quarter, and then we created some subcommittees that met a little bit more often that handled some of those decisions that didn't need a true enterprise sort of stamp of approval. And so we changed the pace of review and improvement by changing who, what, and where we were meeting and approving. So I'd suggest to everybody, you know, it's okay to give time back to your leaders, even if they're showing you wonderful support. It's okay to right set with them, and even if they're super enthusiastic, you know, you don't have to take up all of their time. Use their time and their power and energy when you need it the most, instead of always having this constant meeting cycle. Was one of the big lessons that we learned, and it's working out fairly well for us. The executives are happier with it, so now we meet for a little bit longer, but only once a quarter, and they seem to, because it's also once a quarter, everybody shows. So it's got some good to it, but we had to be ready to say, we're ready to dial this part back and improve the process overall for participation.
Excellent advice, excellent advice. All right, Lori, let's stick with you here. How can data governance executives get feedback from the front lines of care about how their policies are being implemented or received?
Well, that's tricky. I think sometimes people give feedback without knowing it. I think sometimes when they come to their leadership or their executives, maybe they're not giving feedback directly about data governance policies, or maybe they're giving feedback about something else, but there's an element of data to it. And we need leadership to be listening for those opportunities to see how maybe there is a new policy that needs to go in, or maybe we need to tweak one that's already in existence. I think people would rarely, or at least what I've seen, people rarely come up and say, hey, I have a problem with this data governance policy and here's why. Instead, they kind of say, well, here's my problems in my real world and my day-to-day job duties. And for them, they're not thinking about that from a data governance perspective. They're thinking about it from getting my tasks done and clocking out. And so when those issues kind of come up to leadership, it's leadership's job to kind of pick out where data governance fits in problem solving for that day-to-day issue from the front lines.
Excellent. Kim, feedback from the front lines?
I agree that that's a hard conversation to have and ensure that we make sure that it's a reasonable conversation. I want to say, in particular, when people talk about the subject, especially in frontline, perception is key. So back in the back office where we may not always understand the impact of the policies that we change, so we need to really be cautious, understand the impact of policies, and track through if the perception of I'm reluctant because I don't want to change is authentic, or if it's really something that's affecting their workflow. And we have to investigate and track each one of those scenarios so that we can move forward. Nothing can stop a program like this if you make rash changes without understanding the impact and then cause delays in care, understanding the impact of what we're doing, and really making people's work harder. The goal of governance in the long run is to make data more accurate and make people's lives easier. So we have to, I think purposefully of how we take feedback, take it seriously, and understand where we want to go after we receive it.
Very good. Chris, any advice on how you think data governance executives can get feedback from the front lines?
Yeah, and I would certainly echo that the sentiments that both Lori and Kim shared are not unique. We've seen this as a common theme, not only in healthcare, but across industries, that, how to appropriately, get engagement and solicit that feedback. And we've really made a big effort from a Collibra perspective to integrate those capabilities directly into the platform. So the ability to raise data issues as you see those issues and make sure they get routed to the appropriate steward and there's follow-up and tracking on those issues. Folks very quickly stop giving constructive feedback if they don't feel like anybody's listening. And we also find that it's really important to provide transparency. So being able to not only define your policy, have it implemented across a given set of information assets, but again, have that ownership to that policy visible to the organization so that when I'm experiencing and working with that policy or data assets that are impacted by the policy, I understand who the owner is so I can engage them and provide that feedback. And then finally, just being able to have, quick, easy capabilities to do things like ask the expert. So if I'm stuck working through something, where do I go to find the right individual that can help navigate what may be, a structured process? How do I get to the expert and really have that dialogue, which can lead to, real meaningful improvement for the organization? So just a few of the things that we see, and certainly really facilitating collaboration throughout select collaborating, getting feedback from all the stakeholders, capturing all of that information as you're going through the discussion and the dialogue, making that visible as part of the definition, as part of the metric. How do we arrive at this point? Helps provide that comfort and really gets buy-in to the organization, because concerns have been addressed and you're providing that feedback throughout.
Excellent, thank you. All right, well, it's time for our poll, which you'll see open to the right. Please select the 3 most significant drivers for your data governance program in 2018. Self-service analytics, driving analytics adoption, big data, data warehousing, master data management, data quality, data protection, information security, regulatory pressures, population health, clinical quality programs, and merger and or acquisition or other. If you want to just pick 3, we would appreciate that. So your top 3. Go ahead and answer that poll, and we will come back and look at the results in a few moments. Kim, let's go with you. Which executives must be on board and supportive in order to see a high level of compliance with data governance associated directives and guidelines? If they aren't fully on board, what are some strategies you've used to get them on board?
Well, with any large project and program, and I'd like to say program, it's important that, you know, it's about as high at the top you can get to be engaged in the work that we're doing. That does not mean that the CEO has to be there every single day. But what it means is that when we escalate, when we see workarounds, that we have them engaged so that we can encourage compliance and have everybody walk the talk. I think that's really what data governance is about. So there's personal reasons why different definitions arrive, why different processes arrive. And once we standardize, to get adoption, we need to make sure that everyone falls in line, or at the very least understand that if, say, there's 12 definitions, if we can narrow it down to 3, that we understand what they are and that we call them different things. But when we have personal interests walk around and have go around our process and we don't address them authentically, then it can undermine the process. So you need, in particular, the folks who have the power to change and keep people accountable for the domain you're working on, and we need senior leadership around, especially when you're talking about driving analytics adoption, self-service, in those areas, up all the way to the top, because that's where different key stakeholders have different programs and different reasons why they need slightly different definitions, and they can route people back and ensure they follow the process.
Excellent. Lori?
Well, when you say which executives must be on board, I'm tempted to say every single one, but the reality is very different. I would recommend, if you're having a hard time getting buy-in or getting exposure to your program, I would take a look around your organization for other projects that already have really great support. Most projects have some element of data to them and therefore represent an opportunity for data governance. So if you find something that already has great traction, staffing, support, leadership, maybe that's something that you approach and say, hey, I'd like to add a data governance aspect to this so that your outcome is even better, so that it's starting to be standardized, and, you know, so that can be a part of, you know, making this the most efficient and effective, you know, go live possible. So that would be my advice if you're looking to try to expand or try to, you know, get on board with some other opportunities, is just look around. It doesn't always have to be a project that comes from your program. And kudos to you, Kim. I say that all the time, just like that. It's a program and a project. And I think that sometimes we need to look for those projects that are outside of natural data governance so that we can go ahead and attach to them.
Very good. Chris?
And I would certainly, you know, second a lot of those efforts. It doesn't always have to be, you know, the highest level executives within the organization. You know, any governance initiative or any data initiative that you're attaching to really should be, you know, clearly tied back to a business challenge that's owned by that executive. So it's really finding that alignment, and that's having that understanding of what is the true value of the effort that the organization is undertaking, and that your governance initiative is really trying to support as part of the broader program. So it's finding that right level, understanding who owns that pain. In some cases, it may be the VP of analytics, because you're really enabling use of the existing analytics capabilities. You're driving adoption of that analytics program. In other cases, it may be a line of business executives that where you're really trying to drive that operational efficiency out of a key process within the organization. So understand that it's flexible and it'll change based on the specific initiative, and hopefully those come together into a coherent program that you can align yourself to from a strategic basis. But certainly break down the problem, as they say, you have to eat the elephant one bite at a time.
Very good, very good. All right, let's take a look at our poll results, and you should be able to see those results. So, Chris, I'd like to get your thoughts on this. You asked for top 3, and what we have is 70% with answered master data management and data quality. So that was number 1. And then tied for 2 and 3 were self-service analytics and merger and/or acquisition. So your thoughts on those results?
Certainly, as to be expected, a little higher probably on the master data and data quality side than we sometimes see. A lot of the efforts we're seeing are aligned around analytics. But I think it's a good representation of the fact that there are, key data challenges driving every healthcare organization. And it's behind those issues come along a set of governance challenges that are often almost as important, if not more important, to unlock than the data challenges themselves. And often when we find organizations, jump into a specific data or technology issue, they find that the governance challenges haven't been fully addressed and vetted early on in the process. And so certainly we see in the areas of master data management and data quality, a lot of organizations come back around after initial efforts from a technology perspective and really look at, okay, now how do we start to govern that process of really mastering our data? How do we govern that ongoing data quality process on a regular basis? Certainly we all know that merger and acquisition is driving change in the industry. It's always shocking to me how we think that we can suddenly start to report as a consolidated enterprise, having merged 2 organizations that don't even have the same types of staff or same types of encounters or even the same types of patients. And so being able to really start at a foundational level, understand how things are defined, what they mean within your environment, within the organization that's either being merged or acquired, understanding how you can map any differences is really critical to support these activities, and ultimately will happen. Often it happens kind of after the fact. We kind of put people in the same room and force them to figure it out, which is one approach, but that need to really drive a clear understanding, I think, is the most effective way that organizations can go into any type of merger and acquisition environment.
Very good, very good. Thank you, Chris. All right, what I want to do now is knock out some audience questions because we've had a number of them come in. So let's start. How to merge the traditional, the question is, how do you merge the traditional decision support team that falls under finance with the emerging clinical analytics needs? Lori, let's start with you.
Well, that's always a toughie. And I think that some of that, I think that some of it has to do with data policy and consumers, and I think some of it's very cultural about where people are, what they're looking for in consumption, as well as how you're presenting and providing your data and in what tool sets. All of those things play a factor, right? It's the who, what, when, and where. And so bringing those together can be a tricky thing. And so again, I'm going to have to go back to my comment about your culture and what is involved in your culture to kind of build that bridge or find that project or find that leader that can help you do it. Some of it's got to be you, but some of it, maybe it's best to find a champion that has a different level who can help build that bridge for you.
Great. Kim, any thoughts? Let me know if you need me to repeat the question.
No. I would say that finance and clinical improvement are two sides of the same coin. One of the issues that we found is the finance group will say, oh, you have to use the coded record because that's how we get paid and that's the true diagnoses. And then the clinical folks will say, yeah, but they're wrong because of miscoding, or this code got was missing, or somebody did something wrong and the data quality stinks, and so I don't trust it. And you have this go-between between them all the time. But we need both of them, of course. We need to ensure that we have proper clinical diagnoses and our processes are there, and we also need to ensure that we get paid because that's how we stay in business. So see them working together. Well, one of the things that I say is that, so we use clinical data while we're doing concurrent analytics and process improvement, ensure we have proper diagnoses. It's a leading indicator of how the record's going to end up. So we use them together. We know that there may be fallout. There's fallout because of the proper coding processes, also because of clinical changes that happen in the patient. So understanding that we tell folks that we use them for different purposes and that they need to come together for us to have a holistic process.
Chris, thoughts?
Certainly, I think, one of the things that, helps in any of these situations is having an understanding of why each organization or each group is approaching the problem in the way they are. And so really helping to increase transparency to peel back the covers and really get people in a position where they can really start to collaborate and understand those differences helps to break down those barriers. So understanding how is decision support sourcing their data, why are they making those decisions? They're perfectly valid. They really are. And the reasons that, the clinical decision teams and analytics teams are taking a different path are very valid as well. Generally what I find is that there's less difference than there is commonality. It's just like when we travel internationally, we get exposed to kind of that common foundation, which makes us all the same. And the same comes out within each organization that we work with. And so as you start to kind of peel back the layers of mystery and you're able to articulate why you're using the coded diagnosis value versus the raw clinical data, you're able to provide some transparency and help break down a lot of those barriers. And people can acknowledge their differences and build on their commonalities and strengths.
Excellent.
If I were to add, do you mind real quick if I add?
Please.
So a perfect example that I like to give in this context is the thought of an ER visit. So I have this thing that I call lens of the consumer, and depending on who the key stakeholder is, their lens can be very different. So if you think of the concept of what's an ER visit, as a registration clerk, I come in as people come and queue into the ED. I want to know every single person who comes in because that affects how fast the turnaround time is, how many patients I saw. If I'm a physician in the ED, I want to know how many people came and saw me. So if there was a elopement or left without being seen before they even got to see the doctor, then I want those people who eloped out of my record. If I'm finance, I want to see everyone who was actually discharged, because if they eloped at all, even if they saw the doctor or not, then we can't get billed, and so it doesn't count. And then I have a CEO saying, what's wrong with you people? Don't you understand that a person's a person? But every single one of those, and I only gave you 3, there's PI people who only want to see elopements because they really want to improve and not have people leave in risky situations. So every one of those user groups has a valid reason to, with their workflow, that they have to have these slight differentiators in what this metric means to them. And they're all correct, they're all appropriate, and we need them. But what we need to do is we need to define them different so that when the CEO is in the meeting and they say, why are these numbers different? I don't trust you people. We can use better language so that we understand the differences of the work that we do.
Excellent, excellent. Thank you for jumping in there. Lori, what would you see as your greatest tangible outcome?
So much of data governance is intangible that it's hard to put my finger on one, but I'll give you an example of something that we've seen that as a slow build that has come out in hard statistics. So we have been able to significantly reduce patient duplicates and overlaps in registration records. And we know this because in my master patient index team, where we have people, hand merging and taking care of all the duplicates, as well as deduping, taking and unstitching overlaps, we used to be creating as an enterprise so many dupes and overlaps per week that we could probably only get to about 80% of them, and about 20% per week went to backlog. So we have been able to improve, just through education, the rate that our enterprise is creating duplicates and overlaps to the point where now we're taking care of 100% of the dupes and overlaps going ahead and being created across the enterprise, as well as now tackling some of that backlog. And we're seeing some very interesting patterns now that we have the bandwidth to take a look at the backlog. And from that, now we're seeing these much larger patterns around duplicate patients or empty registrations or basically dead data in our systems. And it's leading us to do a mass data cleanup and archiving cycle through our EHRs. That will probably, our first run, we're just the low-hanging fruit. We're going to be taking out about 8% of all data in GE, which is our main system. So it's creating less work for us, and then we get to take that bandwidth and apply it to even more efficiencies and procedures that we're going to see benefits from.
Excellent. Kim, let's go with you on this question. What are the entities that you are working across? Meaning what kind of data are you integrating from where? How do you practically get the various factions to agree on definitions?
That's a lot to unpack. So, we integrate data across to do, if in particular I'm talking about master data management, it's essential that you have your entire ecosystem. So with our provider master, we had 17 different provider credentialing applications, as well as our EMR on, so we have Meditech on the acute side and Allscripts on the ambulatory side, and we need all of that data so that we understand where the different inconsistencies are and that we can highlight them and resolve them. So depending on which subject you're talking about, they may be different types of applications that you need to integrate, and they can be small or large. Can you believe that we have that many different applications that just have the physician dictionary? To me, that was astonishing, and how long it took to integrate. Can you repeat your final question? Because that was the one that I was going to answer, but I got.
How do you practically get the various factions to agree on data definitions?
Yes, absolutely. So one of the things we do is understand how much is already out there. So before you can fight for a best practice, getting in a room and say, hey guys, what do you think our definition should be? That can be a very long-winded conversation that may not really result in anything beneficial. So what I'd like to do, especially on important ones, is find out what the current state is and create an understanding of what's used the majority of the time. So we start with majority rules. See what's out there so we can reduce the definitions. It's shocking when you look at all of your reports. A story that I like to tell is that when we did a EMR standardization, we had 69,000 reports and only 22,000 employees, so that's 3 reports per person. And people said, oh, there's still no data. It's like, how can there be no data? We had 300 census reports, 300. And so if you talk about how much that costs, that it costs $1,000 per report that you build, then you can create this understanding of how much work is being done and, unfortunately, how much ROI we're getting and utilization. So I know that only 40% of reports are ever run, and even less are run more consistently. So that's pretty shocking. So when you show what the majority is using, and then you can quantify how much utilization is of these different areas, you can narrow it down. And maybe you don't get one definition, but you, like in my ER example, but maybe you can take from 300 to 5, and you can list them side by side. And by listing them side by side, not only in your KPI dictionary or glossary that you're using, but technically too. Being able to create a KPI so that people don't have to ask the definition, they don't have to create it themselves, will have people comply more. And then one of my number one things is you need to stop asking them. I found that one of your questions, and I don't know if we're going to get to it, is what's the cause of bad data governance? I really think it is. A lot of times we're self-inflicting. Someone will say, oh, could I have a report? And we say, well, what kind of report do you want? What do you mean by sepsis? And then we ask them every single time. Well, we know from our own data what the standard definition is, or at the very least the most common definition. And instead of us grilling someone who doesn't want to answer the question, doesn't know the answer, and they just kind of guess, we can start with what's used all the time, and then if they say, no, that's not what I really want, have a broader conversation and make sure that that's approved. There's plenty of regulatory definitions that are publicly available that we can start with, which is where we started, to create these definitions and start using that language, start technically having that available instead of, you know, everyone's going to need all the IDC 10 codes listed, but you could also have a flag that says, okay, this is CMS's sepsis. And then you can get buy-in through that and drive the technology and the solutions that you're already implementing within your own team to create the wave to move towards standardization.
Excellent, excellent. Thank you. Chris, let's go with you on this one. What skills need to be developed among business unit managers to be successful with self-service analytics? How have you approached this need, or how would you recommend hospitals approach this need?
Yeah, great question. Certainly one of the things that we see is that a lot of the efforts around self-service analytics have focused on, you know, how do I get users trained in the, you know, latest, greatest, easiest to use BI tool. And certainly, you know, understanding how to manipulate the BI tools and work in kind of the self-service environment is critical. But one of the big gaps that we see is that people certainly don't understand the data that's available to them. And so making sure that you have the support in place so that your targeted self-service population, whether those are you know, department managers, individual contributing employees, whatever that level of self-service that you're really trying to drive, has the appropriate context for the data that they're working with. So how do I allow them to find that data set of our referring providers and make that clear as to what we really mean is included within that set of referring providers as they start to work with that in the self-service BI environment. It's really about capturing a lot of the expert knowledge that exists within our professional and dedicated analytics teams and making that reusable and modular for the various self-service users. So it's not only just having the business definitions, but being able to relate those concepts that I, as a business or clinical user, understand actually out to key metrics, to critical data sets that are relevant to my being successful in that self-service BI initiative, and then making sure that as we go down that self-service BI path, we're not perpetuating this black box or undocumented analytic problem. You know, one of the biggest problems we see time and time again with self-service analytics problems is we've just massively exploded the number of reports that were managed, numbers, information sources, and potentially even, you know, just the variation and results that we're all showing up to in the meeting. So you have to, throughout your self-service process, make sure that great if we're going to enable these people to have access to that information, but there has to be a clear trail as to what was done in that self-service environment to get to the answer, so that we're not spending all of our time, once again, kind of debating why we got different results.
Excellent. All right, we have one more audience question, and let's give each of you a chance to respond, and then I think we're going to be out of time for today. How do you, Lori, let's start with you. How do you get started? Can you do data governance piecemeal, or is this always an organization-wide effort? It would seem you'd have to have a global design versus departmental projects.
You know, not necessarily. Some organizations have to start small and kind of do a proof of concept. And so, like I said, pick your project, pick a small project, or do something that's small. You know, we have lots of different opportunities inside of data governance when it comes to master data, metadata, data quality. Pick one. Don't try to do it all. Don't try to boil the ocean if you can't. Just pick something and go with it. And the thing, too, is just if the first one doesn't work, try the next one. Don't give up. Be kind to yourself, and just keep pushing. Don't ever say, well, you know, we tried data governance and it's over. It's never over. Just start again. Try something different. Be your own cheerleader and just try something new. You will most likely find like-minded people, and then you'll start to get that traction, and then you can grow bigger. Now, some of us are blessed with being able to start organization-wide, but it doesn't always have to be that way. Whatever you have available, that's what you go with. Just don't say, well, I don't have total buy-in, so I'm not going to start. Just start somewhere.
Excellent answer. Kim?
I agree. And you can start in almost every part of the organization. One of the first things we did was just make a little global code in our EDW. I found there were 50 ways to die in our organization. And so how are you going to do mortality if people didn't even know, you know, what to pick about whether the patient died or not? So that's a simple way. You can even do data quality. That happens all the time. People are starting to move away from phone numbers and more to email addresses. Can we work with registration, or can the registration take that on themselves to improve the frequency that email is associated with an account to improve billing and communication with our patients? So you can start in almost any area. Another thing that we did was try to improve financial reconciliation. So if you have more than one source system, can you create a report that shows the variance between those applications by pulling the same definition and making that visible to the organization? And even, we talked about education, even just having more education and documentation for frequently asked questions, so that when people ask the questions, you can disseminate consistent messaging about the current standards that you already have.
Excellent. Chris, we'll give you the last word.
Sure, thanks. And as an enterprise governance platform vendor, we're often, kind of asked this question of how do you get started? And even though we do really focus on that enterprise breadth, we never recommend that you really try to start at the enterprise level. You won't get the resources, you won't be able to demonstrate meaningful success. So even if you do have the entire organization on board and the CEO is standing outside your door waiting for you to get rolling and giving you every resource on the planet, there's a certain amount of process and time that it takes to really be successful in these efforts. So you're going to have to break down that problem. And so really finding those key champions, find someone who is like-minded, find someone who has that need. Put a tactical win in place. Build on that win. Try again if you don't get the success that you were looking for. Do keep moving. But make sure that you break down the organization, because while we may all, have the same, email address and name on our badge, we all have different aspects that we bring to this, and no organization is homogeneous enough to have one solution from a governance perspective drive everything across the organization. And so you're going to need to adapt your program, you're going to need to adapt your tactics for each part of the organization that you work with and each set of priorities. So break it down. Find those champions and, build on incremental success, deliver quickly, and make sure you're aligned to a real problem that the organization cares about. Documentation for documentation's sake doesn't get anybody anywhere. Tie back to that business value, find out where the priorities are in the organization, and make your bets there. Bet big, be exposed, and take some chances.
Excellent. Thank you. Well, that's about all we had time for today. When you close out your WebEx window, you're going to be taken to a post-event survey. If you could answer that, we'd appreciate it. Regarding continuing education, attending our events gets you one CEU towards the CHIME CHCIO program. Let CHIME know you were here, and if you've asked us to do so, we will. If you need a certificate of attendance for another CEU program, you can use the final slide in this deck. You'll receive an email when our archive recording has been posted to our YouTube channel. If you'd like us to produce a webinar on the topic of your choice, you can reach out to Nancy Wilcox from our team. And you can go to our website to see our robust schedule of upcoming webinars. With that, I want to thank our panel, Kim Jackson, Lori Moore, and Chris Cooper, and I want to very much thank Collibra for making the event possible. And of course, I want to thank you, our attendees, for coming to our events. Everybody have a wonderful day. Thank you.